I'm Dr. Sharda Jain. Menopause Day is on 18th of October. There are many misconceptions and misinformation about menopause in people's mind. I'm going to talk about 20 common misconceptions and misinformations in urban women and how these misconceptions and misinformations can be solved. First misconception is or misinformation is weight gain. कि मेनोपॉज का मतलब मोटापा नहीं, ये बिल्कुल करेक्ट नहीं है. Menopause does not guarantee motapa for all women. Hormonal changes can affect metabolism, but lifestyle processes or choices play a significant role in weight management. खाना तो कम खाना पड़ेगा. Second misinformation people have in their mind is that sex will not be possible. Menopause does not mean the end of sexual activity. While there may be changes in libido and vaginal dryness and pain as a result of the same during sexual activity, maintaining a healthy sex life is possible, and now there are ways and means available now where you can definitely have a vaginal rejuvenation. That information your doctors should be able to give it to you. Many people feel that menopause means weak bones and osteoporosis. Menopause does increase the risk of osteoporosis and fractures due to decreased estrogen hormone, but it does not automatically mean weak bones. We have to be proactive at the age of 40 years for our bone health. Proper nutrition and exercises can help to maintain bone health. People think कि memory loss होगा. While some women may experience cognitive changes, severe memory loss is not a typical symptom of menopause. It is essential to differentiate normal aging from more serious pathology and issues of this kind. Many women think hot flushes are going to be there for all women. Not all women experience hot flushes. Only 25 to 30% experience hot flushes, night sweats during menopause. It varies greatly from person to person and from country to country. People feel hormone replacement therapy is must for all. Hormone replacement therapy is a choice. Almost 30 years back, hormone replacement therapy was given to almost 50% of postmenopausal women. Then came WHI study, and hormone replacement therapy came to be as a stop in prescription of doctors. But now the pendulum has gone to the other side, and now the doctors feel rational menopausal hormone therapy can be given, and for symptomatic patients, and for shortest possible time and a shortest possible doses. People feel that the menopause starts at a specific age, that is 50 years. Menopause can begin anywhere from late 40s in our country. The average age is 46 years, but it can start anytime after 40 years, but it must stop by 60 years. It is individual and not necessarily a set age. People think once you have menopause, there is no pregnancy risk. Pregnancy is still possible until a woman reaches a true menopause, which means no periods for 12 consecutive months. And now people have started talking about not cessation of periods, but stoppage of complete ovarian activity. Many women feel that the depression is inevitable. Menopause does not guarantee depression or anxiety, although it can increase the risk of both depression and anxiety. Mental health support should be available, and they should keep themselves busy in some activity or the other, especially for the community work. They feel that there is no need for birth control. It is related to the previous question. Until confirmed menopause, contraception is still a necessity and to prevent unintended pregnancies. In my own experience of last 50 years as a gynecologist, I have seen that 15 or 16 pregnancies I have seen in women after age of 50 years. All vaginal bleeding is menstruation. No, this is the biggest mistake. Postmenopausal bleeding need to be closely evaluated by a gynecologist. It is not always just residual menstruation, because there's 10 to 15% chance of cancer, underlying cancer, so must be investigated thoroughly. People think that after menopause you all age rapidly. Again, big no. Menopause is not a fast track for aging. Healthy habits, healthy lifestyle can slow down the aging process. All menopause symptoms are physical. Again, this is not correct. Emotional, psychological symptoms like mood swings, anxiety can also be a part of the menopause in good number of cases, nearly 40 to 50%. People think the loss of libido is permanent. Again, this is not correct. While changes in libido can occur, it is not necessarily permanent. Communication and the lifestyle changes can help. And now these days, the laser therapy and the lifestyle can definitely do a vaginal rejuvenation, which more and more educated people should definitely take help. It is an isolated event? No. Menopause is a phase and not an event. Menopause is a phase and not an event. Perimenopause can last several years with symptoms of varying from person to person. One size fits all treatment. Again, this statement is not correct. What works for one woman may not work for another woman. Personalized treatment and lifestyle adjustments are crucial, and this is what the doctor's mantra is. People think it is end of the career ambitions. No, menopause does not signal the end of career aspirations. Many women continue to excel professionally during this particular phase. In fact, they outdo what they have done prior to menopause. No more physical activity. Again, this is totally wrong. Regular exercise remains essential during menopause. It helps to manage weight and maintain overall health. People think it is a sign of being old. Menopause is a natural part of the female life cycle. It does not make a woman old or less vital. In fact, many people now think that old age starts at 80. There's an institute in Germany which just simply works on that particular philosophy. And in the end, people think if there's a loss of femininity. Menopause does not diminish a woman's femininity and grace. It's a part of life, and embracing it can empower women to feel confident and strong. 1/3 of their life they have to spend after the menopause. So addressing this misconception as misinformation is very, very important. There should be open talk among the women in urban areas. They should understand the menopause properly and its effects, promoting their overall wellness and the quality of life during this particular phase. Thank you very much for patient hearing.